Good day, everyone. Thank you for giving me this opportunity and this platform. My name is Omuchineke Ogochukwu, and I'm presenting for the team NEXTGEN Minds. So today, I'm excited to share a practical, scalable solution designed to tackle a serious and persistent challenge in Nigeria, which is the access to quality healthcare in rural communities. So the solution we propose is called Mobile Health Boot, a project born out of first-hand insight, user research, and a drive for equity in healthcare access. Today, I'll walk you through the background of the problem, the rationale behind it, and I believe it's worthy of your support and funding. So I'm going to be defining the problem for you in the next few minutes. I've introduced the idea. Let's take a moment to understand the problem we are trying to solve and why it really matters. Millions of Nigerians face life-threatening delays due to lack of nearby affordable healthcare. In many rural and underserved communities, something as simple as fever, a minor headache, a pregnancy complication, or even a minor injury can turn deadly, not because help doesn't exist, don't get it wrong, but because most times these medical centers are quite out of reach, are far, or it's too expensive. Now, this issue ties directly to one of the world's most pressing global challenges and opportunities, which is universal access to healthcare. The United Nations identified this as a key pillar in achieving health equity worldwide. If we can solve this locally, we are contributing to a global solution. Firstly, the major reason why this issue is critical and we need to solve it on time, we need to prefer a good solution, which I will be presenting to you in the long run in the course of this presentation. Because of the inequitable access, which leads to deaths, which could be prevented. These losses could have been avoided if the right systems are in place. Secondly, when people are sick or lose family members, they often fall deeper into poverty, spending their little income on travel, traditional medicine, or late treatment. Thirdly, the ripple effect is a weakened national development, less productivity, more strain on the economy, and rising public health costs. So this isn't just a health issue. It is a social and economic one, and solving it could unlock healthier lives and stronger communities. So let me introduce you to Grace. Grace is a 32-year-old cassava farmer living in a remote village in Benue, right? If you can see on my screen, you can see that this is a picture of Grace, and she experienced severe abdominal pain, but had no access to a nearby health facility. She eventually traveled over 20 kilometers to get help. So by the time she saw a doctor, her condition had already worsened. She was diagnosed with a ruptured ovarian cyst, which could have been avoided earlier with timely medical as advice, right? So Grace represents millions of Nigerians whose health are jeopardized by distance, cost, and poor healthcare infrastructure. According to the World Bank in 2023, approximately 45.72% of Nigerians live in rural areas with poor healthcare facilities and poor healthcare access, long distances, and high transport costs, few professionals, and high morbidity from preventable diseases. This has continuously become the story. People often travel long distance to reach health centers, incurring high cost of transportation and long wait times only to find poorly equipped clinics, and sometimes too few medical personnel. Now, this is a recurring cycle that discourages timely care and worsens health outcomes. This lack of access most times lead to high rates of preventable illness and diseases and death as well. So our user persona, Grace, is a farmer. Her name is Grace. She's a 34-year-old farmer from Benue State. Her biggest need is affordable, nearby real-time access to doctors, right? But she faces serious barriers, which is no healthcare facilities close by, long travel distance and wait times at urban hospitals, no knowledge of NHIS, which means she pays high out-of-pocket medical fees. Grace here represents the everyday reality of many rural Nigerians. She is why this project matters. Here is the pie chart that almost half of Nigerians' population, which is like 45.7%, live in rural areas, and below we compare healthcare access. There's a major disparity. If you can see it from the chart, you can see here doctor availability in rural areas is 20% lower, is 20%, while in urban areas you have 78%. Now, people living in these areas will continuously be faced with the issue of healthcare challenges, and we would always have more issues of deaths and high preventable illness rates in these rural areas. You can also see from the table, this table shows that there's a major disparity in doctor availability, NHIS enrollment, and facility readiness. In rural areas, doctor availability, equipped facilities, and NHIS enrollment are significantly lower, just like I said earlier. Now, these are not just statistics. This represent actual real people that are breathing, people that are alive, people that are actually going through the situation. Like you can see in our last slide, we mentioned Grace, and this is somebody that is currently facing this situation. If you can provide the solution, it would not just be solving her issue, but be solving millions of Nigerians' problem. These visuals also prove the need why intervention is urgently needed in rural areas. So this is a picture of our proposed solution. The mobile health booth we are proposing is a solar powered modular kiosk equipped with a mobile app interface, right? That connects patients in remote areas with certified doctors via video calls. It includes a mobile app for virtual consultations, NHIS enrollment, and health education, all in one secure, user-friendly platform. It's not just a booth; it's a digital gateway to life-saving healthcare. This is the wireframe of the app, built up as a solution to the healthcare inaccessibility problem we are faced with in rural areas in Nigeria. So on the left is the app features. You can see patient registration, NHIS sign-up integration, secure video consultation, and health education in local languages. We also have a screen that displays everything, how these different windows interact, and how the user can access and make use of this our app, which powers the mobile booth. So on the left, you can also see the features. On the right, you can also see the wireframe of the mobile app. If you can look here, if you can see this, can you see my screen? If you can see that, you can also see here which says doctor code. So it shows when you log in. The app features the different windows on our app. So you can see patient registration here. The patient gets to register, gets to sign up on an NHIS, and if you have to make a consultation, you can do it here in the booth via a secure video consultation. This does not just save you the cost of transportation. It does not just save you the cost of long distance. It also saves you the issue of, oh, I don't have an Android phone. We already have that set up there in the booth, right? So these visuals represent our preliminary design phase and help you see what the end user will experience. Going further, this list here shows the several painful barriers Nigerians in these rural areas are faced with on a daily basis. Issues, delay care, and worsen the outcomes. So imagine I have a toothache, I need a dentist, but I can't get there on time, and I have to travel for like 2 hours. Moving over to my next slide. In this slide, we've carefully outlined the estimated cost, the timelines, and resources we need for this project to be carried out. For instance, a single mobile health booth will cost approximately 5 million to build. It can be completed within 6 weeks using local vendors and skilled artisans. Ongoing maintenance is budgeted at 50,000 per month. This makes it both sustainable and community manageable. Looking at something that will solve the issue in the long run and help us curb this problem we're trying to solve. Our solution is not only impactful but also cost effective, achievable, and scalable across multiple rural locations. So for recommendations, we would recommend deploying solar powered mobile booths that can reach remote communities. Each booth will allow patients to register for NHIS, speak to doctors through video calls, and get basic health education in their language. We'll also run awareness campaigns to build trust and drive adoption, just like we have seen here. Why do you need to fund us? This is our promise to you. If we are funded, we'll build and deploy the medical booths, train local healthcare workers, and start the medicine services. We'll track progress to make sure it truly helps rural communities, not just saying it and going to deliver the solution without actually checking if it works. We are going to monitor this and see that it solves the problem which we intend to solve. Your support will not just help us in saving lives, but it will also help us in bringing healthcare closer to those who need it the most. Why does this solution matter? This solution matters because it brings healthcare directly to people in rural areas where clinics are far away and doctors are few. By using video consultations and helping people get health insurance, we reduce delays in treatment, lower travel costs, and most importantly, we save lives that would otherwise be lost to preventable conditions. It is a simple idea with the power to change lives. Thank you so much for listening and for being a part of this presentation.